Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. So ethmoidal polyp is what we are going to look at. So the main etiological factor is going to be it is due to allergies. And it is usually affecting the middle-aged. So it will be in the mid-age group. So site of origin is a lateral wall. So lateral wall of nose is usually affected. The lateral wall of the nose. And what is the clinical features? The clinical feature is that the nasal stuffiness. So there is nasal stuffiness. There is presence of headache. Next is due to sinusitis. So there is nasal stuffiness, there is headache due to sinusitis. There is also sneezing. So the individual will sneeze. So there is sneezing. There is a watery nasal discharge. So watery nasal discharge. And there is anosmia, hyposmia. There is anosmia, hyposmia, as well as mass protruding from the nasal cavity. So mass which produced from the nasal cavity. So there is nasal stuffiness, headache, sneezing, water nasal discharge, and anosmia, hyposmia, and the mass which produced from the nasal cavity. So how was the findings? The findings is on anterior rhinoscopy. So anterior rhinoscopy, we will find the multiple bilateral polyp. So there will be multiple. It is bilateral polypi that are smooth. So bilateral polypi, they are smooth and they are glistening. They are smooth, they are glistening, and they are grape-like masses, often pale in color. So they are grape-like and they are pale in color. They are made sessile or pedunculated. So they may be sessile or pedunculated, and it is insensitive to probing. Insensitive to probing, and do not bleed on touch. So there is no bleed on touch. Now, what is the investigation of choice? Investigation of choice is nothing but IOC. IOC is going to be NCCT, and the treatment is going to be FESS. To learn and grow daily like this, please do subscribe.